Infectious disease prevention and control. There are several things that we can do to prevent the spread of infectious diseases. There are a certain set of diseases that are called healthcare associated infections. This an infection is considered a healthcare associated infection if a person receives an infection while they are receiving health care for another condition inside of a healthcare facility. That it could include whether or not they're at a hospital, they went in to get blood work done, they went in to get a CT scan done. If they were at an ambulatory surgical center for inpatient, outpatient procedure that day, and they ended up with another infection that was not related to why they were actually at the healthcare facility. That is considered a healthcare associated infection. There are several things that we can do to prevent the spread of infection, but proper hand hygiene is the single most important aspect of controlling infections. True or false? To reduce the incidence of healthcare associated infections, we should use proper hand hygiene before and after caring for a client. True or false? Should we use proper hand hygiene before and after caring for any client? That is true. True or false? Should we use proper hand hygiene before donning gloves and after removing the gloves? So putting on the gloves and taking them off. Should we wash our hands, use proper hand hygiene? Yes, we should. Standard precautions are a set of infection control practices used to prevent transmission of diseases that can be acquired by contact. And that contact could be with blood, body fluids, non-intact skin, including rashes, or mucous membranes. After tuberculosis is a condition in which Mycobacterium tuberculosis causes infection, typically in the lungs, but it can involve other body systems. The World Health Organization estimates that annually around 8 million people develop active tuberculosis globally. When someone has active primary tuberculosis, we should be using airborne precautions. In addition to standard precautions, we should be using airborne precautions. Airborne precautions apply to a patient that has known or suspected to be infected with a microorganism that's transmitted airborne or droplet. In order to prevent the spread of this airborne disease, we can wear a N95. For the most part, when you are hired for a healthcare facility, specifically hospitals, surgical centers, and places like that, as part of your onboarding, you have to get fit tested to ensure that you wear the proper size so that you will know the proper size of N95 that you should wear. So in the event that you're taking care of a patient that has a disease that is spread through airborne or droplets, you should also, in addition to standard precautions, you should employ your airborne precautions. You should be wearing your N95 respirator. This prevents airborne transmission. Many times they will, if they know or if they can, the facility can accommodate it, they will have that patient in a private room And that patient would only leave the room if it's essential. So if they need a chest x-ray done and radiology can actually come up to that patient's room, that's what will take place rather than the patient going down to the radiology department. N95 respirators is an example of PPE, personal protective equipment, that are used to protect the wearer from particles or from fluids contaminating the face. The CDC actually oversees the N95s that regulates the N95 regulators. It is important to recognize that the optimal way to prevent transmission of microorganisms, whether it be a virus, a bacteria, is to find out how it is transmitted and then employ those precautions that will prevent that transmission. For example, we use tuberculosis in this example. So it is transmitted through the airway, through droplets. So those are the type precautions that you will employ. That will tell you what you need to do to try to prevent the spread of that disease process. Contact precautions are used when a person has a type of bacteria or virus on the skin, a wound or sore or somewhere in the body that can be transmitted to someone else if that person comes in contact with that infected person's surface, or if it's a dressing changes. If that person comes in contact, if someone else comes in contact with it, then they are highly the chances of them highly getting or contracting that disease or that virus or that bacteria, it is high. So we would employ contact precautions. So here it is. What should Bob do? Bob is now at home. While he was in the hospital, he was needing dressing changes, and he was on contact precautions. Our signs were hung outside the door. We came in, we had all of our PPE, but Bob is now at home. Bob is now at home and requires dressing changes to the wound. He's gotten better, but that wound has not completely healed. He's still on antibiotics, and he is requiring dressing changes. What instructions would you give Bob about the dressing changes? Of course, we want him to wash his hands, but particularly for the dressing changes, the soil dressings should be disposed of in plastic bags that are tied securely. And then you can place those into another garbage bag. Culture is social behavior, institutions, norms, their beliefs, their knowledge, their customs and habits that people or groups of people actually have. Particularly for this exam, we're talking about Muslims and Jewish followers. They require food to be prepared according to religious law. In the Jewish faith, it is called kosher, which also requires the separation of milk and meat. True or false? Muslims and Orthodox Jews have similar dietary restrictions in that both groups require that their followers eat only meat that has been slaughtered according to their religious law. This is true. So if the meat is being slaughtered according to their religious law, it is okay for them to consume. And they both are similar with that dietary restriction. If it is handled in a way according to their religious law. There are several things that will influence our decisions that we make. Cultural influences. The use of drugs, including caffeine, tobacco, and alcohol, the things that we eat, the way we prepare food, all these things are influenced by culture, which are our norm, which is our knowledge, our understanding, things that we consider as our norms. Which of the following should you as a nurse take into consideration that culture and religion will influence the decision about it? So we talked about culture. Those are those decisions that we make based on our knowledge, our understanding, things that are considered to be norms. So which of the following should you as a nurse take into consideration that culture and religion will influence the decision that is made about it? Smoking. Yes. It will influence that. Drug use. Yes. Our nutrition, our food. Yes, it will influence that. We should take that in consideration, that culture and religion will influence smoking, drug use, nutrition, the things that we read, the TV channels, the shows that we watch on TV, and use of caffeine, all of these things. We should, as a nurse, take in consideration that culture and religion will influence a person's decision about these things. Domestic violence is violence committed by someone in the victim's domestic circle, those that are close to the person. It might be the partner, it may be an ex-partner, a relative, a family friend. The Centers for Disease Controls actually identifies 4 types of intimate partner violence: physical violence, sexual violence, stalking, psychological aggression. Some risk factors of violence include low self-esteem, heavy alcohol and drug use, anger and hostility. If a person is currently depressed, there's low income or no income, they've been just laid off of work, which could lead to the depression. All of these things are risk factors. There are numerous risk factors that can influence violence, someone to be susceptible to it, or someone to be the person that is being violent. A top risk factor or greater likelihood for an intimate partner homicide is the wife previously reporting that she has been physically abused. So a top risk factor or a greater likelihood for intimate partner homicide is if the wife has previously reported being physically abused. So we as a nurse, we want to identify some resources within the community. Sometimes we have to establish partnership with different agencies. Like in our area, it's called Saber Sanctuary. That's where people can go, families, men or women, children, they can go, and it's a safe house. So you have to identify those services, establish those partnerships with those different agencies to see what their rules and regulations are so that you can give that information over to your patient. You may have to identify some economic or financial resources also to support them while they are getting newly established and away from the violence. Physical neglect refers to failure to provide adequate food, clothing, shelter, hygiene, or necessary medical care. Emotional neglect refers to the omission of basic nurturing and acceptance and caring for essential health development. You as that school nurse, you are the catch-all. You're that go-to person. A teacher might ask you, as the school health nurse, to assess a child for neglect. Some findings or some things that you might see that might indicate that there is actual neglect is lack of weight gain. The child may be wearing dirty or torn clothes. Case management is implemented with individual clients. So it is individualized care. Case management, in contrast to the definition of care management, involves activities implemented with individual clients in the system. Care management is an enduring process in which a population manager establishes systems and monitors the health status, resources, and outcomes from an aggregate. But case management is best described when care is implemented with the individual client. A primary problem that could result from healthcare today being given by many different care providers. Now they want to, for the patient, for the most part, to receive that specialty care if they can. So many clients will have a primary healthcare provider and also these other specialists. But something that could result as a result of having the primary care provider and all of these different specialists, it could result in overuse. Overuse can occur if once the patient is sent to the specialist, they rerun the same exact exams initially. Now, it's different if the specialist runs or orders another exam after some treatment or something has been done that they're trying to determine whether or not the treatment or the intervention is doing some good. Then they rerun, for example, another x-ray. But sometimes if initially that specialist, they run another x-ray, person just had an x-ray last week, and they order another x-ray, the patient has another x-ray done, may or may not, the chances are that there's not going to show any change in that. They will not have any change in the x-ray, or not that as much to deter that specialist from going ahead and starting treatment. So that will lead to overuse. Underuse can occur when the patient is like, no, I'm just so used to my primary care provider, just let them do it. And so even though they have been referred out to see specialists, the patient might not go and get those services from the specialist. For one, the specialist might be in another town, so it may be inconvenient. That access to healthcare, they can't get to the specialist. There are many of reasons why the patient might not receive or seek out the services of the specialist, which will lead to underuse. Or it may be gaps in care. So the primary problem that can result from healthcare today being given by many different care providers is overuse, underuse, or gaps in care. Those things might occur. Case managers take care of everything from A to Z. So if you're a case manager in a rural county, you will need to have identified all of the stakeholders. You will need to identify the norms within that county, within that specific area. You need to seek out all the resources, whether it be the industry that's in that town pays for after school, or offers after school payment for so many of the children, so that the parents can go to the neighboring town to get health care. So healthcare in case management in a rural county is different from case management in a more urban area, because those resources are just readily available. So we do know that, and when we say different, it's because we're talking about rural. We do know that there are some challenges with access to healthcare, things being available, public transportation, the specialties all together. So if a person is moving from a large city and they're moving to a rural area, in the area of case management, they will face some challenges, because especially if they have not identified and understand that the rural area their resources, and it's just a kind of a different way of providing that patient care. Case management time is demanding, thus it is restricted to complex cases. Case management plans should be individualized for each client. A person who has high cost chronic diseases would most likely receive case management.